What's up, Dunwoody? Welcome back to the podcast. It's all about Dunwoody, Georgia. My name is Matt Weber. Show is brought to you by Dr. Brett Friedman from Village Orthodontics and Discover Dunwoody. And today I've got a special friend on. This is Sarah Friend, and she is introduced to me by Rosemary Watts from Create Dunwoody. Why don't you just feed into what you do and how you got into it, and we'll go from there.
Absolutely. Well, thank you so much for having me.
Yeah.
So, my name is Sarah Friend, and I am a medical oncologist. So, I'm a cancer doctor. And I had been at Emory for 8.5 years. And then I decided to start my own business, which is offering support for cancer and people with cancer or their families, and but in a different capacity. So myFriendMD is the company I started, and
Which
it
is a
is
great name, by the way.
thanks.
I'm
Yeah, yeah,
surprised
yeah.
that
I was
URL is still available at this point.
very surprised it was available. It was awesome that it was. So myFriendMD in serving in that capacity, it's 1 hour cancer coaching sessions. So I found it tough in the traditional healthcare model to keep my doctor visits to 15 minutes. I just found it hard. I
Yeah.
found it to be pretty easy in the first visit because you get a whole hour. So we could talk to patients and their families and really explore the issues. And I felt like that was sufficient. And then for follow up visits, 15, 20 minutes, maybe even 30 minutes at times was just still not enough time. So I decided to found myFriendMD, where I only offer 1 hour sessions, and there's no such thing as double booking, no waiting, no waiting rooms. It's just you book at 9 a.m. and there's nothing else I'm doing at 9 a.m. So I'm not seeing four other people that were put in the same spot. And so I can really give you the dedicated time to discuss a lot of the other issues that come along with a cancer diagnosis. So
Yeah.
if somebody has an abnormal mammogram, the biopsy shows cancer, their doctor visit isn't for 2 weeks to discuss this. That would be a perfect opportunity to book with me. I can go through all the what if scenarios based on the mammogram report. We can say the possible stage, and I could probably walk you back from a lot of those anxieties that you might be having, because we can say, practically speaking, you're going to be a long term survivor, and we can sort of go through a lot of the anxieties you're probably having. So I
Well,
think
after that very first visit, you're told that and you just sit there and you don't even think about the questions you need to be asking. And,
yeah,
I told my wife, and they always end up calling on a Friday. I don't
always,
know. Is that a thing? Like
always,
they
yeah,
call on Friday and tell you
yeah,
that you have cancer. And then they're like, we'll talk on Monday. I'm like, no, I need to talk to my wife. I need, more information. And
yes,
I,
that's exactly
this
right.
is, I think this is a great idea. And yeah, really cool.
Thank
And
you.
is it
Yeah.
all virtual? Do you have an office?
Yeah.
Okay.
So I don't through this platform. It's all virtual. But in the future, I would love to scale and get, providers and all the different subspecialties. So that way, if you wanted to talk with an expert and sort of get a master class in the topic, right? So if you have this disease, then there's the expert for that. You could talk to them for an hour, and instead of just Dr. Googling it, you could talk
Yeah.
to someone who really understands it and can tell you all the what if scenarios and what you really need to focus on when you talk to your doctor. And
Yeah.
so, just like what you said, how your mind goes blank when when you're in the room and the word cancer is spoken, that is a really valuable time where prior to that visit, we prepare for it and we help create your question list. Like, these are the important things that need to come out. And sometimes, even if you don't know the answers, you can hand the question list to the doctor or the nurse who's in there. They'll write it for you. And then
Mm.
that way, when you leave, you have those answers and you make productive time out of that first visit, when usually you're just, potentially scared and not
Yeah.
thinking in the way you might be later once you have time to process.
Yeah. And I mean, you're as much, I know you're a doctor, MD, but you are as much as like a coach and a counselor than
Yes,
anything else. And you're also
exactly.
not the one getting paid for the actual
Right.
treatment, the actual, cancer treatment. And so it is like a good way of just differentiating, just having a second opinion, having somebody
Exactly.
else to talk to.
Yeah, no, that's a good point. So I definitely am trying to work with medical teams, and
Yeah.
actually a lot of the people I've spoken with, we talk with the doctors. I don't have my own office through this venue, so I'm not taking patients with me to be treating them in an office. I'm just supporting them behind the scenes. And I'm happy to work with your doctor and, like I said, help to create those question lists so that way you are empowered to make decisions that are right for you regarding your
Right.
care.
Yeah.
Um,
Do the doctors, how do you get the patients? Like, are doctors referring you, or are the doctors not so thrilled that you're in this with them,
Yeah,
or how does that work?
honestly, the people that I've spoken with about this who have known me from the community are thrilled about it and are like,
Yeah.
yeah, yeah, so if someone wanted a second opinion, it's just an easy way to book immediately.
Yeah.
But also,
And the
you
doctors don't
know,
have an hour to talk to people. And so
yeah,
I'm sure they're
yeah.
happy to have you.
Yeah, like in the traditional setting, it's very difficult to spend extra time, especially when your panel is full. And most
Right.
practitioners have full panels, so it's very difficult to really sit down with one person for a whole hour, especially on follow-up visits. So I think that there's a role for both the doctor, the medical team, as well as me in the, I guess, doctor coaching navigator role, where I can take that extra time and talk to you about your fears. And I think of it as maybe you have time to ask your doctor maybe questions 1 through 4 on your list, and I could be
Mhm.
maybe 5 through 20.
Yeah.
So those extra things that may involve work and the impact psychologically on your children and some of these other issues that maybe aren't as relevant to your treatment plan in that moment, but you still may have those questions that you want answered. And
Right.
so people always think of the questions after they leave. Always.
Yeah, and I mean, maybe I'm just a normal guy, but I don't understand a lot of the stuff that the doctor is saying. Like, I need to relay that
Yeah.
through my wife, and so I mean, and
Yeah.
that's an option too. Like, my wife could be on the call with us at the same time.
Absolutely. Yeah, there's no reason that we can't talk to more than one person. And I also have a lot of handouts that are made with information that's really helpful at depending on which stage you're at. So if it's new
Mhm.
diagnosis, these are like the 10 things you need to know. And so I can also provide that to you. And like you said, your family can absolutely be on the call. There's
Yeah,
no reason they can't be.
yeah,
So I want to be supportive and helpful and be a resource for knowledge, for anyone who's going through this journey, who just needs a little bit of extra attention, and the more complicated the treatment plan, the more questions there may be.
yeah.
And like you said, I'm happy to support the family as well.
Hey there, dog lovers. Discover Dunwoody is showcasing all the best pet-friendly spots around the city. From parks and patios to events made just for pets, furry friends are always welcome here. They even feature Pets of Dunwoody on their socials. If someone's traveling with their four-legged family member, have them book a stay through whatsupdunwoody.com/hotels. That booking supports the podcast too. And for a list of pet-friendly events and activities, visit whatsupdunwoody.com/events. Tell them Woody sent you. Yeah. Where are most of your patients coming from? Referrals from doctors, or just to find out
Yes.
about you? Okay.
Actually, yes. A lot of my clients are have heard of me because maybe they knew me from before I started this.
Mhm.
But then other doctors have also referred to me and said, yeah, my patient. So would love to have this time to really unpack this in more detail. And so doctors have been a huge referral source for me.
Yeah. And you've seen it for 8 years now. I mean, you know the side
Yeah,
effects, and you know what is
absolutely.
gonna happen, and most of the
Yeah.
patients don't understand what's going to happen. At
Yeah,
least
and
that's
there's
how I felt.
yeah, well, exactly. And then there's also new things that come out, so the treatments that you have now are going to be different than the ones in 4 to 5 years. So
Yeah.
it's a lot of looking, next, like, why was my friend treated differently than me? And it's like,
Yeah.
well, if we really break down the type of cancer you had, stage and subtype, there's probably a reason and or year of treatment. So I think there's a role to have someone who's, helping you through this journey because the whole thing is really confusing.
Yeah.
We know more about breast cancer than the other cancers because the public knows October is Breast Cancer Awareness Month. So
Mhm.
they can buy the pink flavor of water or the t-shirt, for the breast cancer walk. So a lot of money is generated in breast cancer. So
Yeah.
because of that, there's a lot more nuance to it. So there's a lot more that we know about it. Whereas in, let's say, pancreas cancer, it's often treated the same.
Yeah.
with similar regimens of chemo. But in breast cancer, there's so many different subtypes that we now know about. So there's a lot of really exciting advances, but it's confusing. Even for some doctors, it's confusing.
Right.
So there's a role to have a navigator in your court, I think.
Yeah, and I mean, I always look at things this way just because this is what I'm interested in. But like AI going into doctors, it's becoming more and more prevalent. And a lot of the time, you've gone in the future. I think you're going to go through AI and into a doctor, and there's still like such a niche for somebody to actually talk to you. Like it doesn't. That doesn't. You can go on ChatGPT and
Absolutely.
find out answers, but
Yeah.
most people want to talk to people.
Yeah, exactly. And it's you're that's exactly right. That we have algorithms in cancer for a lot of stuff. So based on your stage, your diagnosis, your subtype, we are able to tell you, and ChatGPT or AI could absolutely say, "Yep, do this 6 months of chemo." And you're
Yeah,
like, "Wait, what? What does that mean? How does that impact me?" And yeah, I'm still old school. I love to talk to a person,
yeah. Most
you
people are old
know?
school at this point.
Yeah,
Yeah.
yeah. So that's yeah, it's probably similar information, but I did find someone I know close with was Googling for her daughter that had mono. And
Hmm.
immediately, the Google AI feature told her, could be life threatening and all these other things. And it was like she was terrified. And
Yeah.
it's like for some people, it goes to the worst extreme when that's
Yep.
really unlikely to be the case. So it's really important to have someone to break it down and really tell you the implications for you and how it differs from what they found on their search. So you're right
Absolutely.
about that.
I mean, and Google can be more dangerous a lot of the time. It can make things more
Yeah.
scary. I remember
Oh, for
when
sure.
they told me about the melanoma, it was 0.04, I think was like the size of it. And I heard, because obviously I was taken back by the whole phone call. I was at work when they called. And so I told my wife 0.4. She went on Google and it was like, 50% chance of me dying. And she just freaked out. And like,
So scary. Yeah.
all weekend long, like it was, I don't know. It's just tough.
It
And
is scary.
having
And you're
access to
right.
somebody like you would have changed everything, really.
Yeah. Thank you for that. And you're right about, especially in the melanoma world, like the point 4 versus 0.04 is very
Yeah.
different.
But it's meaningless to me. Like just hearing the numbers, I'm like, oh, yeah,
Yeah.
whatever.
Yeah. Yeah.
Yeah.
For
And
sure.
that's on my mind because today is Melanoma Awareness Month. And so I
Oh,
always try to tell
good to
people,
know.
go get their skin checked. So if you're watching
That's
this, go
great.
get your skin checked. It is
That's
important.
good.
Are you working with just breast cancer at this point? Like how niche have you gotten with this?
So, breast cancer is my expertise, and that's what I see most of. That being said, as an oncologist, I'm also trained to see
So you
other
kind of
types
know
of
all of
cancer.
it. Yeah.
Yeah, so I still could be a helpful navigator for the other cancers as well.
Hmm.
But that's the area I spend most of my time and what most of my research has been in. But overall, I think in the navigating capacity, I could be very helpful with letting you know the experts in the area, letting you know
Yeah.
when you should get a second opinion, when a clinical trial is favored. And a lot of the questions you may have with a different type of cancer could still probably be useful in helping.
Yeah. What you're doing here, is this a new thing? Like I've never heard of this personally. Have you heard of people doing this? I
I
mean,
have not. All the navigators I've seen are not physicians. So I've
okay.
seen a lot of patients will become advocates and help other patients, which is great.
Yeah.
Same with there's nurse navigators. A lot of different institutions hire them because they're so valuable.
Yeah.
But a physician navigator, I've not heard of it.
Okay. So you're going on your entrepreneurial journey here.
I am, and it's
Very
it's
cool.
exciting and scary at the same time.
Yeah, I'm sure. Well, how do people get in touch with you? Is it
So the best way, there's two ways. The first way is if you need a session to book with my online link at myfriendmd.com. And I can also be reached through messaging through either Instagram or TikTok at SarahFriendMD, and that's SARAH, and then friend, FRIEND, MD.
okay? With what we've been discussing, I didn't even think to go to your Instagram and TikTok. Is that something you're doing? You making content already?
I mean, I hired a team who's awesome to help me
Okay.
with that. I don't exactly feel that comfortable in that space, but they're
Yeah.
making me get out of my comfort zone
That's the
and
world we
talk
live in
about.
now.
I know that's what I've been told. And yes, it's not what I would have done if I was by myself on this journey, but
Yeah.
the team
You'd be
that
good
I
at it though. You're easy to
thank you.
talk to and fun,
Thank
and
you. It's
yeah,
definitely a little bit scary putting yourself out there in that way. Out of
yep.
my I'm pretty good with
And you're supposed to
one-on-one.
be a professional too. And so
Yeah,
I feel like doctors and
I know. And they want to just ask me about all the controversial issues, and it's
yeah.
like
Well, that's
I'm
the
like,
clicks,
ah.
you know.
I know. And that's how they think, and it's a good thing. But
Yeah.
yeah, so I'm learning. I'll say that. Please don't judge me based on the way I appear on that, because it's
Well, long form stuff like
out
this
of
is
my
always
comfort
better,
zone.
in my opinion. So
I agree, for
yeah,
sure. Yeah,
cool,
more
cool.
time gets into someone and their personality. So
Yeah. Well, I think this is awesome. And I actually am going to introduce you to somebody today.
that'll
So
be
yeah, check
awesome.
out myfriendmd.com if you want to reach out to Sarah. And thanks for coming on the show. And you are also a Dunwoody resident. We didn't even mention that.
Yes,
You're
yes, I live
right,
in Dunwoody,
right
Lemonade
here.
Days.
So
Yep,
if you see
love
her
this
around
place.
town, say hello.
Yeah, please do.
Okay.
Hi.
Thanks, Sarah.